Not long after Golden Retriever Gus was adopted, his owners found a mysterious mass on his lip. It turned out to be an oral mast cell tumor, a potentially fatal cancer that can develop on or just under a dog's skin. Veterinarians removed it, but knew there was a good chance the cancer had metastasized to his lymph nodes. That's why he's taking part in a new study with Morris Animal Foundation-funded researchers at Colorado State University to test a state-of-the-art imaging technique that could make finding hidden cancer cells as clear as black and white.
Treating cancer is a game of numbers. And so in order to cure cancer, we have to get 100% of those tumor cells out of the body. And the issue becomes is that if we don't know where those cancer cells are, we can't go after them. So the ability to non-invasively decide where cancer is helps us make decisions.
Head and neck cancers make up to 6 to 10% of all canine cancers. Unfortunately, Griffin says current techniques to diagnose their spread, such as ultrasonography, are not very reliable, making it difficult for veterinarians and owners to know how aggressively they should treat a patient.
Making these decisions up front, prior to having to do surgery or chemotherapy, is actually really helpful, I think, for owners and for dogs.
The technique starts with an initial MRI of a dog's lymph nodes to get a baseline. Then the dog is injected with nanoparticles, in this case, harmless, microscopic bits of iron. Those are soon engulfed by special white blood cells called macrophages, which clear the blood of cellular debris, and then return to the lymph nodes they consider their home base. 2 days later, after this has happened, and results are detectable, the dog has a second MRI. Iron appears black on certain MRI images, so if a completely healthy node is full of macrophages, it should appear all black. But cancer cells push macrophages out of lymph nodes. So, if cancer has invaded even a small portion of a lymph node, that portion should appear white on an MRI. Right after the dog finishes that second MRI, it's taken to surgery to remove any of the lymph nodes in the region of the tumor. That way, Dr. Griffin can compare her imaging findings with what's actually in the lymph node. In Gus's case, surgeons confirmed what was found on imaging: cancer cells within the lymph nodes. Doctors removed them, taking out a potential reserve of cancer cells. He's now receiving chemotherapy, so far with great results. Eventually, Griffin will likely test the technique on other parts of dogs' bodies, and even in cats. If her study is successful, she wants to train radiologists how to use the technique themselves.
We need to have it so that it's not just me reading these all out, because our ultimate goal would be to be able to provide this service to dogs with cancer around the world.
Helping their owners make the best decisions for their beloved pets.